That sounds. Thanks, Jen. Okay, well, I think we're probably good to get started. Welcome in, everyone. My name is Brett Golden. I work under the Behavioral Health Incentives team. I'm here with a few of my colleagues today, and we're going to be talking about House Bill 2024, um, which is a new grant opportunity that we're hoping to roll out here shortly and soon. We'll be going over the overview of eligibility, what the intended purpose of these grant funds are for. And then we'll also talk a little bit about the application process and then some of our scoring priorities near the end as well. Um, so if we're able, can we get the presentation up on share screen? We'll just get going. All right. Thanks, Kelly. So welcome in everyone again. Happy to be here. Today we're going to be talking about House Bill 2024. This is the second informational session. We have three planned, with potentially more planned as well, depending on interest and when we might post our application to Oregon buys. So next slide, please. All right. So for today's agenda, Um, like I alluded to, we're going to talk about the background of House Bill 2024. We're going to go over briefly the definition, scope, and program goals, the entities that will be eligible, and what the intended use of these dollars are for, along with reporting requirements for any entity that is awarded, and a little bit about the process for applying and how we will evaluate and score our applicants. And then hopefully near the end, we'll have plenty of time to have some Q&A. And then also just looking forward, we also will have another informational session come November 4th from 1:30 to 3:30 p.m. Um, for any other questions, or if you do have questions for us, we do have an email. I'm not sure if maybe someone from our team can put our HB inbox email in there, and then also maybe the link our website as well. That would be great. We're going to post the recordings there and any other pertinent materials that we'll discuss today, along with announcing when we will be opening up that application. So thanks, team, for that. All right, next slide. Okay, so as I'm sure most folks on the call know, we're facing a behavioral health crisis. Where there's a shortage of providers, and it's making it very difficult for a lot of Oregonians to access mental health and SUD treatment. And it is really, really severe for individuals from historically marginalized communities and for those that are most affected by health inequities. Next slide, please. Right. This is a visual of that, of where provider shortages are, where you'll see that there are a lot of shortages, especially in our rural and frontier areas. Next slide, please. Yeah, a little bit more information on that, as I'm sure all of you know, but just to kind of hammer it home, we have almost 300,000 adults in Oregon that did not receive the needed mental health care in the past year, many because of cost barriers or provider access. Um, Children and youth are hit hard, where 55% between the age of 12 and 17 experience depression. And then we do have a report cited here from the Mental Health America. Oregon was ranked 42nd out of the states along the index of 17 different health related metrics, including prevalence of disorders, prevalence of substance use, unmet need, workforce access, and insurance coverage. So that's where we come to with House Bill 2024. So next slide, please. And so with that, it aligns well with our strategic goal at OHA with our ambitious goal of eliminating health inequities in Oregon by 2030. So there's the pillars down there below of how we try and do that, transforming our behavioral health system, strengthening access to affordable care for all Oregonians, fostering healthy families and environments, achieving healthy tribal communities, and building OHA's internal capacity and commitment to eliminate health inequities. Next slide, please. Okay, so House Bill 2024. This was recently passed in this year's legislative cycle. It directs OHA to award educational grants to eligible entities to support the recruitment and retention of behavioral health care providers. The solicitation aims to provide educational assistance to qualifying behavioral health entities to support, sustain, and grow their workforce so they can be more equipped to expand their services and increase their delivery of quality care to all Oregonians. Next slide. Really quickly, just to define some of these terms, behavioral health care would be services to support individuals who have mental health and then also SUD disorders. And then OHA will establish this grant program to award grants to eligible entities. These grants awarded on this section must be used to foster recruitment and retention. So that's the major driving force that's behind this bill of behavioral health providers so that they can continue to provide services and expand their services to Oregonians. Next slide, please. Okay, so here are some of the goals that we have outlined. Again, recruitment and retention of behavioral health providers, especially in rural, frontier, and other high need areas across the state. Increase the number of individuals training for and entering the behavioral health workforce. We want to expand services to Oregonians, especially in rural and underserved communities. Support career advancement, opportunities for behavioral health providers, and increase our system's capacity to provide culturally responsive care that is embedded in equity-centered, of course, cultural responsiveness, destigmatization of services, promotion of restorative healing, and community empowerment. Next slide, please. Okay, so this is where we're going to get into details, I'm sure, where most folks are interested to understand this bill. So this is the first stage. I kind of like to think of it as what eligible entities are eligible to apply. So you have to be one of these five entities. You can be an entity that has a certificate of approval or a COA or a COA. You can be an entity that offers medication assisted treatment services or MAT services. Or you can be an entity that is contracted with Oregon Youth Authority to provide behavioral health and substance use disorder treatment services. Or you can be an entity that is a certified opiate treatment program, or an entity that provides withdrawal management services. So that's the first stage. You have to meet one of these criteria here. Next slide, please. So for this second part, when you check off that first box, then all eligible entities must do all of these things. So they must operate an outpatient or residential facility that provides team-based care, and we'll define that here in the next slide, that provides team-based care to individuals with acute behavioral health needs. And then also, all entities must provide behavioral health care to adults or youth of which at least 50% are uninsured or enrolled in the state medical assistance program, OHP or Medicare. Okay, so this is eligibility continued. So like I alluded to, team-based high acuity medical provider. What are we talking about when we talk about team-based? So to qualify under that, the provider must either be a community mental health program offering one or more of the following: assertive community treatment, early assessment and support alliance, ESA, intensive in-home behavioral health treatment, or the second criteria would be meeting all of the following, which would be holding a certificate of approval from OHA, derive at least 50% of annual behavioral health revenue from services to OHP members and Medicare, um, and provide integrated team-based care that includes a combination of on-staff psychiatric provider, an integrated peer support, case management services, or individual family group and community-based services as clinically indicated. Next slide, please. Thank you. Okay, so eligible recipients of funds. So these funds are primarily geared towards our licensed workforce or our master's level clinicians, and then also our certified workforce as well. So here's just a whole laundry list right here, just to give some examples. You have your usual suspects in here, your LPCs, your LCSWs, certified side of things, QMHAs, QMHPs, peers as well, psychiatric nurse practitioners and nurses that provide behavioral health services. So this is more just to kind of show an example of the providers we're hoping to support with these incentive funds. We do have, you'll see the last two bullets, where we will, by case situation and basis, if an entity is awarded, um, look to allow for other providers that might not be listed here, as long as they provide behavioral health services in some capacity with your clinic or with your organization, to also qualify for these educational incentives. And we'll talk about the specifics of what those incentives are here in just a minute. Um, and I know that I'm blazing through this, and I'm sure there's questions in the chat. And I'm sure my team is trying to help keep up with that. So we'll just go through everything. I don't believe I mentioned this at the beginning, but I'll go through the presentation. I'll open up for questions just to have that space where we'll have more time to do that there. So we'll hold off for now. But I know folks probably have a lot of questions. So anything we can't answer in the chat, we'll definitely get to around Q&A, and we might echo some of those questions in the chat as well. All right, next slide. Okay, so these are the eligible incentives. So these are the incentives that are specifically outlined in the bill. So the use of incentives will be scholarships, loan forgiveness, and/or loan repayment incentives, tuition assistance, and then stipends for students enrolled in graduate behavioral health care programs. So you see that graduate behavioral health care programs is underlined there. That is specifically what it says in the bill, and so we are trying to focus that incentive towards your master's level students. But tuition assistance, loan forgiveness, and repayment and scholarships don't follow that same rigidness, I guess I could say. So these are the four incentives that were outlined in the bill, and so we're hoping to abide by that. Next slide, please. Okay, so kind of allowables and not allowables are these next two slides. So grants can be used for the following allowable activities, and so we're talking those educational incentives that I just mentioned, scholarship, tuition, stipends, all that kind of good stuff, loan forgiveness. And then also we want to note that these dollars can be used toward academic materials to help aid in those incentives, right? So books, testing fees, licensure, application costs, things like that, when it comes to just the general cost of education and higher education. And then we have carved out 12% of administrative staffing that is allowed to be used for this grant. So from your total, you can utilize 12% towards administrative costs to staff the program to roll out these incentives at your clinics and at your organizations. These are the cannots. So these grants cannot be used for services or activities unrelated to those incentives or anything related to that is not related to behavioral health education, training, or credentialing. Same thing goes for loan repayment. Salaries or wages for non-administrative staff that are not directly involved in grant implementation. Capital expenditures, which we consider like construction or renovation of facilities, things of that nature. And then also any indirect costs that exceed the 12% administrative cap. And then we cannot use incentives or payments for non-licensed and credential staff without a clear pathway to certification or licensure in behavioral health. So we just want to make sure that whatever the behavioral health staff is receiving, it is leading towards the certification or a degree that will help aid in either expanding their behavioral health services or being able to then provide behavioral health services. And then the last one, reimbursement for expenses incurred prior to grant award date. So pretty standard stuff there. Next slide, please. Okay. And this is our disclaimer. This is something that unfortunately we cannot get around. We've looked into it, but there is potential tax implementations when it comes to divvying out these funds to individuals that receive them. So I'll just read it. All eligible incentives provided through this grant may be considered taxable income for the person receiving them. This means the individual might owe taxes on these funds. Awarded entities should check with a tax professional to understand any potential impacts before giving out incentive funds and should clearly explain any possible tax implementations to providers before awards are made. OHA is not responsible in providing tax advice or determining tax obligations. Unfortunately, I hate saying that. I wish that we had a little bit more of ability to provide technical assistance when it comes to this. We've reached out to DOJ and asked like how we might be able to help with this, but this is kind of the statement that we get back. Um, However, we will be hammering that home and making sure that all providers that do get awarded will know that, and we can try and provide technical assistance, but it will be up to the entity when it comes to final determination of how this can potentially impact their staff. So this slide is just kind of going over how it's going to look from a bird's eye view when it comes to reporting for entities that would be awarded. So if an entity is awarded, these are the main things that we're hoping to capture with it. Is the licensure, certification, or position type of each behavioral health care provider who received an incentive, the amount of grant money spent per behavioral health care provider, the entity's staffing vacancy rate prior to and after receiving the grant, and then quarterly, mid-project, and closeout reports. So from those three bullets there, we're hoping to capture that information from quarterly reporting, mid-project, and closeout reports. We are trying to be very considerate and conscious about administrative burden. So we're developing all of our reports on Smartsheet, where if an entity is awarded, they will fill it out online and then they'll be able to submit without having to go back and forth using Excel forms and things of that nature. So hopefully it'll streamline things, but we are being conscious about that. And that is something that is specifically outlined in the bill. Yes, and then also just really quick that we will be asking other things on top of this. We want to convey success. We want to understand our workforce and where those gaps are and where those needs are. So there will be additional things that we'll be asking for, but again, being conscious about administrative burden on your end. We know how busy all of y'all are, so we are definitely keeping that in mind as we move forward. So we'll be striking a balance between those two, making sure we get information so that we can continue to fund these types of incentive programs moving forward. Next slide, please. Okay. So this is all very tentative and subject to change because I changed it this morning. So I wish that this is as accurate as possible, but it's not. This is our best prediction at this time. I'm trying to be really conservative with this, but hopefully we can post our application well before what we have on here. So for any timeline updates, things like that, go to our website, sign up for our newsletter. We will send an email out to everyone to let folks know when they can actually apply to this grant opportunity. It will be posted on Oregon Buys. We'll talk about that later in the slide. And the application will be on Smartsheet as well. So hopefully that'll help with some administrative burden too. So Tentatively, sometime in the middle of November, we're hoping to post the RFGA. And then from that, it will be 30 days that entities will be able to apply for this opportunity. So with that, if it's 11/17, somewhere around December 17th, we would close that. And then for the end of December, we would be working to evaluate and score those with our panel, and then do notice of awards by the new year. Um, our goal was to try and have contracts start by the new year, but I think it probably might look closer to starting at the end of the first quarter or starting into quarter two, which would be 4/1 of 2026 is when we have all those contracts executed, and those funds would be out to y'all for those that are awarded. So again, subject to change. It's really hard to project when that will be posted. We have submitted all of our materials. They're just with OC&P, Office of Contracts and Procurement, and they need to go through legal sufficiency and all that kind of stuff. So that does take a little bit of time. And then we are also hoping to translate all of our materials into Spanish as well, with that dedication when it comes to advancing equity for all communities. So we want to hold true to that, but we're trying to also get things out as soon as possible. So we really appreciate everyone's patience on that. Next slide, please. Okay, so really quickly, going to talk a little bit about the application and how we aim to prioritize specific entities. We have priorities for specific entities in particular that deliver services that we've identified as areas of need. And those would be specifically child, youth, and family organizations. And so that includes school-based adolescent and early childhood behavioral health providers. We want to prioritize individuals involved in the criminal justice system. So that also means prioritizing entities that are involved with folks in the criminal justice system. Um, and then organizations that operate mobile crisis intervention or mobile response services. We also want to prioritize rural and frontier communities. And so these priority points will be automatically assigned based on the location of the applicant's service site using Oregon's Office of Rural Health zip code-based primary care service area. Um, so if you are a rural or frontier organization that is applying, make sure that your primary site will that you put your primary site as where your rural and frontier clinic might be, because that one will be the one that will be automatically scored points. So we'll have it all outlined in the application. Happy to talk a little bit about that more in our Q&A. We also want to prioritize organizations that provide office-based medication-assisted treatment services. And then we also will prioritize organizations that um, aim to prioritize education these educational incentives to the following providers. And so that would be providers from communities who are underserved or providers who deliver culturally and linguistically specific behavioral health services. So we're hoping to also diversify our workforce, where community have their voices heard and is reflected in their communities. And so most of that scoring will be done via the essays and the two-part essays, which we'll talk about here in just a minute. Next slide, please. So there will be two narrative essays, which is aligned with the application and scoring criteria. We want to make sure that these applications are going to be evaluated based on the clarity, the feasibility, and alignment of the purpose of the strategies that we're aiming to do here with the goals of the Behavioral Health Workforce Incentive Program. And so that's our team here at OHA. All right. So the first essay is asking kind of the general information, the meat and potatoes of what every entity is aiming to do with these incentives and kind of the specifics and the logistics of what that's going to look like. So we want to have an implementation summary, outline how these incentives will be implemented, distributed, talking about key steps, responsible parties, um, proposed service commitment for these incentives. We want to see these incentives have some sort of service obligation with them, whether that be like a 2 year or 1 year, whatever might be fitting for your entity to try and recruit and also retain behavioral health providers. And that in this first essay as well, we'll make sure that entities also outline the types of providers that they hope to support. So whether that be your licensed workforce, like your LPCs, LCSWs, or certified workforce like QMHPs, CADCs. And so you could have um, you could have a multifaceted approach when it comes to that, where maybe some incentives are for your licensed workforce and maybe some are for the certified, and so on. Also, just general information we're hoping to get on the number of providers that you intend to support with these funds. And then the big one that I'll highlight is the rationale for the number of providers. Explain how this number was determined, and including workforce need, organizational capacity, and anticipated impact on staffing challenges. So how are these dollars going to impact your organization or clinic or site? And then also a big one being the cost effectiveness and return on investment. So we're hoping to see for entities that are applying, describing how these incentives will strike a balance between being cost effective, where they would be significant for the individual receiving them, while also trying to strike that balance of trying to award as many incentive funds to your providers or to potential employers that might be interested in joining your workforce. So it can be a very hard balance to strike, but that's what we're hoping to see when it comes to return on investment is how strong are these incentives? How do we believe that they will keep providers at your eligible entities, while also trying to help out as many providers as possible? Next slide, please. And then the second essay question we'll ask essentially, with these incentives, with what your plan is, how is this going to help expand your services to your communities? So you'll describe how you'll address service gaps, promote equity, especially among culturally and linguistically specific providers. We want to see folks highlight, strategies to expand services in underserved areas, or in high need areas across the state. And any type of evidence-based models, where applicable, and quantitative and qualitative data supporting that will only strengthen your application. Next slide, please. Okay. So the funding guidelines, I don't think we have it here, but we have $3.7 million to distribute. And so these numbers were a collaborative effort with a lot of folks on the team to try and figure out how these dollars can impact as many organizations as possible while still having a strong impact per the individual organization. So the maximum award amounts based on the total number of staff employed by the organization. So if you are a small organization, which we would consider under 75 personnel, that full award would be $150,000. Medium organizations, so 75 to 125 staff, that would be $180,000. And then a large organization would be 126 or higher, which would be 225,000 as the max award. So organizations that are awarded may not receive all of that, but they are able to request all of that. So there might be some negotiation there. So yes, 3.7 million, with those being um, the size categories organization. So we know that it's not a lot, but we're hoping that with this, we have a model that can show and convey success. So then our hope is that we can continue these type of grant programs moving forward. Okay, so application submission and selection process. So we will be posting the RFGA. So once that closes, we're going to have a single point of contact who will perform a initial administrative view of applications received by the submission deadline for completeness. Those that are determined to have completed their application will move forward with the grant review committee for further review. The grant review committee will review each application and will excuse themselves from any of the process if there's a conflict of interest. Um, and then reviewers will document the review of each application using the criteria found in attachment B, scoring rubric. We will post that eventually upon conclusion of the individual reviews. The grant review committee will come together to discuss applications and finalize the justifications, recommendations for grant awards. So pretty standard process when it comes to an RFGA. And like I mentioned, it will be posted on Oregon Buys. If you are not registered with Oregon Buys, we strongly recommend you do that um, before applying, just so you'll have everything ready in their system. Um, and then hopefully from there it'll be pretty straightforward. Like I mentioned before, we are hoping to post our application on Oregon Buys, which will lead you to a Smartsheet link um, with those essay questions, and then with the budget table that you'll need to provide. We recommend that you take the questions, the essay questions, and you take that budget table, you work on those first before filling out and completing the application because you can't save your progress midway through a Smartsheet application. So we will, because of that, on Oregon Buys, we will post like just a Word document of what those essay questions are, and then you can work on it from there and then do a simple copy paste once you do the application. And same thing goes for the budget worksheet. So we recommend working on those two before you actually fill out the full application. And from there, it should be pretty straightforward. Next slide, please. Um, just a little guidance on how to register for Oregon Buys. You'll go to Oregon Buys webpage, the top right, supplier registration. If you do run into troubles, you can call the help desk. And unfortunately, OHA cannot provide technical assistance with Oregon Buys. Next slide, please. Okay. We made it. Thank you all for sitting through that. I just want to get through those materials as quickly as possible because I wanted to reserve time for Q&A, which I'm sure we might have here. And I've seen our chat history pretty lively as well. So without further ado, I will open up the floor. If folks just want to go off mute and ask their question, by all means, you can also use the hand raising too, and I can try and do that as well. But um, appreciate everyone being here. Let's open it up to questions.
Brett, looks like we got one hand up.
Oh, yes, sorry. Thank you. Okay, let's go, Jim. Yeah.
Hey, I think I know the answer to this, but after the first webinar, I had made a note in my calendar that the RFGA solicitation application materials would be available in Oregon Buys on Friday, October 24th. Am I to understand that that's been pushed back to November 17th?
Yeah, and that's why I stressed. I wish that we had it posted in a couple days, Jim. Our goal is to try and post it as soon as possible, honestly. We've just been delayed by a month with some things, unfortunately, and so this is beyond our control when it comes to we're waiting on OC&P and DOJ to do their thing, and then from there we got to translate these materials over to Spanish. So it is delaying the process, but we are hoping to expedite this as quickly as possible. And so I recommend just for any like concrete updates, just to sign up for our newsletter on the HB 2024 website. Keep tabs on our website in general, and we can try and keep you updated as best as possible. So our goal is as soon as possible, but we are pushing things back a little bit to allow time for those things to happen.
Understood. Thanks.
You bet. I think it was David.
Yeah, thank you. I noted this in that chat comments. It just seems the timeframes are going to really be a challenge to find effective uses of this. The sort of things I had envisioned, given the timeframes, I'm not sure how that's going to work. Like, I look at the tuition risk as it's I have a staff member that's ready to go a program, and then it's going to, and then I'm only going to be able to fund maybe a year of it before the grant goes away. And then if I look
Yeah.
at loan repayment, maybe I do some kind of like bonus if they stay for a year, I pay off their tuition. I can really only do that for 1 year, and then the next year the grant will be done. So I'm concerned that some of the issues around retention are going to be a little bit diluted with such a short time frame. So I don't know if there's ideas about things that maybe could be more effective. The ones that I'm used to understanding, I think it's going to be hard for me to figure out how to really have maximum use.
Yeah, no, I appreciate you elevating that, David, and I promise it's something we've elevated to upper leadership and to the governor's office as well when it comes to this, because we are talking about educational incentives and graduating doesn't happen overnight, and we know that most grant dollars have to be spent within the biennium. Um, so we do understand that that is something we have constantly put in our bill analysis as well when it comes to any House bills or Senate bills that are being introduced to the chambers. It is on our radar. We are trying to advocate for having more time, and so that's something we're going to look into as well. Is seeing if we can have these dollars be permitted to y'all, well after the biennium. But I cannot guarantee anything like that. And so, unfortunately, as of now, we do have to be creative in that way. But it is something that is on our radars, and we are trying to elevate the same and raise the alarms on the same things that you're addressing, David.
You're just not going to get the outcomes that you have this extra time frame. The point was to have outcomes around retention, and the time frame basically sure that you're not going to get the outcomes. You're not going to be able to see the outcomes based on those things. So I think just knowing ahead of time that this is the way it is, what we're doing is we're just sending a lot of money out that's going to have a one-time impact on people without really the longer needs, which is around retention.
Yeah, I'll jump in here really quick. So, David, that's certainly a good point, and Brett's already stressed that, we've communicated this with folks before. And I also want to say that another allowable piece to this is not necessarily traditional, quote unquote, academic calendar training opportunities. We're talking about other certification opportunities such as EMDR, other certifications that go towards other education opportunities. So it doesn't have to always follow that academic career, although I do realize that master's levels clinicians are the biggest deficit that we see right now in the workforce. Um, but I do want to elevate that, and your point is well taken, and and applicants should be considering that when they're applying. So there are some other opportunities that lead to certification or elevating one's competency that can be counted without looking at just typical CEs. It needs to be weighted heavier than typical CEs for licensure, but it doesn't have to necessarily be a full on master's program either. So and I realize that that's not necessarily clear right there. But I just do want to elevate that it doesn't have to be, you know, baccalaureate, doesn't have to be master's. So I just wanted to stress that.
I appreciate that, Tim. I think that we understand that maybe the scope of the application needs to be a bit narrower than maybe I had hoped it would be.
Hmm. Yeah, yeah, no problem. Okay, sorry everyone. Just wanted to jump in and help out with that.
No, I appreciate that, Tim. Thanks for elevating that. It is important for entities to know that we can look at other educational opportunities outside of just a degree, as long as the certification or whatever type of credential leads to some sort of increase or ability for the provider to provide behavioral health services. I think it was Elena, then Jim, then Christine.
Yeah, thank you. So I'm looking at the criteria, and one of the things that prompts up is if you're an agency that's under 75, the max is 150, but to be able to meet the expectation of having a psychiatric person on staff completely actually negates, if not takes away from the actual grant funds to be able to pay. So for those organizations that are smaller, that amount won't actually, it may not be worth it for us to even apply to do that incentive. Were some of those things considered when you guys took that? Because I mean, I just did a quick research and we're looking at over 200,000 a year for someone who's a psychiatric nurse practitioner. So also some clarity around what that would look like. Are there other options? What are the things that we can or cannot do? Could multiple agencies use one? There's just a lot of questions, especially those smaller agencies that are under 75. The others probably already have it on staff. We've seen this come through in a couple of pieces of communication today. And so it's very much lid flipped like, well, now what? So would love some context or some feedback on that.
I appreciate that, Alina. Elena, it is. It's tough because we were given a small amount of funding to distribute, and so we are trying to strike that balance of um, uh, we came up with these numbers when it comes to making sure incentives are competitive with national and state incentives, um, and then trying to understand our sizes of our organizations across the state and how that we looked at it for like total incentives per individual. Um, and our goal, we came with all these numbers about our intended goal to try and support as many providers as possible while awarding as many individuals. What incentives in particular are you thinking about for, did you say nurse practitioners?
No, so specifically, we have to be able to meet either A or B and meet all of the following, hold the COA,
Hmm.
and then, of course, integrated care, which is on-staff psychiatric, if that's what you're talking about. And while I recognize that, you're also looking at rural areas, and my family's from halfway Oregon, and I can guarantee you that they don't have anything more than 75. So even in the rural areas, it seems a little bit large if those are typically what you see in the rural areas. But what I would like to know more about, and whether that comes out later, is what actually qualifies and what are the parameters around a psychiatric and someone who can do that within the agency, because we've already met most of those. We have had a COA for quite a few years. We are a family based, but we're also outpatient pediatric, which is one of the most underserved populations. And we don't necessarily need, and none of our clients, or a lot of our clients, don't have that medication. So would love to just get clarity around that and how we could still qualify even with that potential gap.
Yeah, no, we happy to follow up with you on that. I think maybe some confusion is our new definition of how we consider team-based care. That was a new insert. That is something that we're trying to align with our Medicaid team on their drafting that definition as we speak. So we're trying to align with that. However, we do want to allow for this grant to be open to as many people as possible. Um, as long as we follow the lines of what the House bill intends. So we can follow up with you, and I don't know if you're able to send us an email specifically outlining that, and then we can hit each point. We'd be happy to do that. And then we'll also make sure to post that on Q&A for everyone as well. So I appreciate you asking that. Jim.
I'm Jim Makaitis with Juniper Mountain Counseling here in Bend. And actually, I had one question, but I know Elena very well. She's part of our COA peers group. And so I just want to make a brief comment about what she said. I find it ironic that if indeed we're required to have a psychiatric provider on as part of our staff, and these funds are meant to go to smaller rural communities and some of those that are really in desperate need of help. I don't know of any of them that have a psychiatric person on staff. So I think you're going to wipe out a whole group of people for whom these funds are intended, if indeed you require that to be, every one of those bullet points. So I just want to put that out there. But then the other question I had specifically was, when we first saw this, it mentioned loan forgiveness. loan forgiveness for our staff would be an amazing thing. But we have licensed, we have registered associates, we have student interns. Um, I have gotten the impression, not so much today, but kind of, excuse me, through the grapevine, that we cannot use this as a traditional loan forgiveness for some LPCs, for example, licensed people that we have on staff, even if they make a commitment to, a certain amount of years of work commitment or whatever. Is that correct?
For LPCs, for loan forgiveness and loan
Well,
repayment.
I guess maybe the heart of the question is like, what constitutes tuition forgiveness? We have a whole bunch of people that are paying off their student loans. Can we use that? Can we use a portion of this to, if we are found eligible, to assist them in that, even if it's just for 1 year?
Yeah, I don't see any issue with that, Jim, and that's
Right.
something that we'd be happy to talk about too. If you do get awarded and things like that. I mean, ultimately, as a team, our goal is to try and help out our entities best possible and be as flexible as we can while trying to still align with what the intent of the bill is. Um,
Perfect.
we know that there might need to be some creative solutions around that,
Right.
but we're happy to explore those options. So absolutely, that's something we would be happy to support as long as we're allowed to do that.
That would be a huge thing for our providers. I really appreciate that. Thank you.
Sure thing. All right. Christine.
Hello, everyone. Thank you for taking our questions. I'm with ARC 77 Recovery Center. I'm here with Kale Harbick, our owner. Uh, One of the questions that we had was you had a list of all the different licenses that could use the funds for different things, and you specifically listed peer support specialists. Are we able to use that to elevate a staff member who doesn't currently have peer support specialist licensing? It looked like you had to have a license before you could use the funds.
No, so that would be totally allowable. We just want to make sure that whatever incentive funds lead towards some sort of credential, license, certification, degree that allows that individual to provide behavioral health services or expand their capacity to provide behavioral health services. So as long as those criteria are met, we want to try, and help support as many people as possible get into the behavioral health field. And so that can include individuals that might not be providing behavioral health services now at your clinic, but
Mm-hmm.
with incentives and with this assistance, we'll get them into a position where they then can provide behavioral health services. So absolutely, we would be happy to support those individuals.
Okay. And then the other question I saw it pop up somewhere that we had a 16 months to spend down. So if we were making a commitment to help someone, say, with a bachelor's or a master's degree, this wouldn't necessarily be able to fund the entire education. So is this something that will come up each year, or what are your thoughts around uh, helping someone actually get through school? Not just a year's worth or just a portion of it.
Yeah, duly noted. I mean, it's something that we're aware of. I think this goes back to what David's worried about as well, and we are as well. When it comes to educational incentives, it takes time for an individual to graduate, and so we know that some entities might have to like award up front to allow for that and support that. This type of incentive funding is very sporadic within our system. We're hoping that with this model we can have it as ingrained where we can then show the successes of that it can be something that is sustainable, that we can move forward with and continue to fund. Very similar like our healthcare provider incentive program that receives funds, I think every year, every 2 years or something like that. So we're hoping to essentially I almost like to think of this as like a pilot model for incentives for behavioral health providers specifically. Um, one thing we've advocated for is more than just like educational incentives. That's a whole nother story. But we're aware that like with these incentives, the funds that you provide might not necessarily have them graduating by the time that this grant period ends. But we do know and we trust our entities that these funds are going to the right people, that will be progressing in the career so that they will be able to provide behavioral health services if it's not within the biennium, at least 2, 3 years down the road. So we are aware of that. And our hope is to provide guidance to when it comes to timelines and things like that of when dollars might need to be spent. And something we're still working on understanding, and we'll do our best to advocate for allowing for those timelines to happen because we're fully aware of that.
Thank you so much. I certainly want to put a plug in for those psychiatric prescribers and us rural folk. We have to piece together providing prescribing services for our clients. So if you ever are at a round table and you want some input, we would love to provide that as there are many people on this call that I think, of course, are looking for that same service for their smaller entities. So thank you so much for being part of the answer.
Yeah, absolutely. Happy to help.
Yeah, I'll just jump into in the chat. I did put a link to the page for the homepage for the House bill itself, and you'll see that there's some links to the chief sponsor. So those are the legislators that sponsored the bill that, essentially wrote the bill, or at least supervised the writing of the bill. So if these are things that you want to communicate to them about, they will receive your messages. So I just wanted to throw that out there as well. So we would love for more support for these incentives programs because this is what our team focuses on, and more flexibility, more funding, and more things are more effective, and giving them the information would be helpful because we tell them sometimes and they don't seem to always hear it. So they will listen to you though. So uh, many appreciations. Go ahead, Brett. Apologies.
No, I appreciate that as well, Tim. And yeah, absolutely. Also encourage all providers on the call to get involved in the legislative process, whether it be a short session or the long session or even emergency session. Any bills that are being sponsored that would impact our behavioral health workforce, we'd love to have knowledgeable providers that are providing feedback on that. Our goal at OHA is just listen to community and providers and then do what they believe is right to help support their workforce. That's as plain as simple as what we're trying to do. So the more that y'all are able to reach out with your voice, it's going to help the overall outcome of these programs and grant funds moving forward. So thank you for that, Tim. Okay, and then I think Alex, you have your hand up.
Yeah, thank you, Brett and Tim, for putting this on. Some of this might be a bit of repetition, but I participated in the October 8th webinar you all put on. And one thing that came up, and this could be misunderstanding, was talking about the loan forgiveness and tuition and stating that really anybody could qualify, but the education had to take place during the funding term. So, like if we had an LPC who graduated 3 years ago, it sounded like there was a barrier to use funds for their loan forgiveness. But if that individual was suddenly taking part in a psychiatric or a different master's program, that some of those funds would be eligible if they were within the course of this funding. It sounds like that might not be the case, that this could retroactively apply to educational debt prior to this funding period.
Yeah, absolutely. So if we're talking about providers that just have a student loan debt, even if it was like 10 years ago, we would still want to try and support that as best as possible. So I don't see any issue with that especially as it relates to loan repayment and loan forgiveness. We know that folks carry that debt for years. So we'd be happy to support those individuals as well, even if they didn't just freshly graduate or something like that. Does that answer your question, Alex?
It does, and that's a huge help. I think I just had one follow-up question, which was answered in the chat, but you mentioned that you all are trying to align the language for team-based care with what the OHA is defining. I think where Elena and myself and Jim might have had a different experience very recently is in this application process, it is saying any combination of these team-based services, which groups in quite a few more people, especially small providers. Um, another incentive program, such as the directed payments, we receive directed correspondence that actually now requires all of those categories. So I guess I understand this is different than the House Bill 2024, but the confusion is that definition going to be aligned among incentives, or is there potentially, you know, misrepresented information between like what this House bill is requiring and what that directed payments is going to be providing or requiring?
I might have to get Tim in to help with this. I think no, I don't think we would have it tied to any directed payments. Would that be right, Tim?
Well,
No, it's completely separate. These are two different things. And even though the definition might seem similar, really the intention is not to limit it to all of those things being required. So we don't want you to, even though the definition is similar, we don't want you to think that they are the same thing.
okay, so to clarify, when you aligning with the OHA definition is really like they could be different. The requirements for this could be different than the directed payment requirements, or is that something OHA is trying to say this is what team-based care means in like all this application processes, all these program processes?
Yeah, so that's really getting outside of this. So I can't really
Okay.
speak to anything, unfortunately, when it comes to directed payments. That's in a completely different division. But so I will say for this grant opportunity that it is a combination and it's not all of those.
Okay. Thank you so much.
Yeah, no problem.
Yeah, thanks, Tim. And I'll post that definition that we have in the RFGA, what we consider team-based, but to kind of reiterate what Tim just said, it would be a combination. So you wouldn't have to have an on-staff psychiatric provider. You would need to have a combination of some of those in there, which would be integrated peer support, case management services, or individual family group and community-based services as clinically indicated. So I think that last point in particular would be a good way to just to qualify for that team-based care definition. But it's something we'll take a look at and see if we can try and have some clarity there when we're talking about team-based services, because I know it's something we're working to try and define. And we do that primarily because this has to be sent over to DOJ, and they love definitions, and so that is kind of our goal there. But rest assured, we want everyone on the call that is eligible based on what we have outlined in the bill to be able to apply. Any other questions?
I think I can just also put a plug in for people also asking for updates. Something that you can also do because, speaking of like psychiatric nurse practitioners and providers, if there's those interested in things like that, they are also eligible for other like primary care incentive programs that are outside of this one. So this one is, more focused on behavioral health, which, they're a part of course, but also they're considered a part of primary care very often. So what I would recommend is going to our webpage, which is our main BHWI Behavioral Health Workforce Incentives webpage, and signing up. We've got an up keep informed menu on the right hand side on that link. And if you click on that, you can get updates by text or email. And so we will be providing updates communicated for this grant program through that. And then also we do get communications from the primary care office about other opportunities. And sometimes behavioral health providers are included in some of their opportunities as well. So it's really not a bad idea to click on that link and get signed up for updates from us. And I think you'll actually get the option to also sign up for updates from the primary care office as well. So definitely feel free to click on that.
Yeah, thanks, Tim. And I just posted the link to the newsletter to sign up for updates, and we do have that on the BHWI homepage. Um, we will also have it on our HB 2024 homepage as well, where you'll be able to have that link to sign up to the newsletter. So we'll hopefully have that up within the week, if not tomorrow. So yes, that would be a great way to stay informed of specific timelines. Like we said at the beginning, we're really hoping to post this as soon as possible. And we do have OHA leadership that is prioritizing, especially this grant, to be pushed out as soon as possible. So we're hoping, with our fingers crossed, we'll be able to post earlier than what we have the timeline on this webinar slide right now. And yes, we will also post that it'll be on Oregon Buys of when it'll actually be posted on Oregon Buys, and the application will be linked to that. Awesome. Well, I think BHWI, we can stay on for a little bit longer for any other questions that might come up. For any other folks that got the information they need, I think we're happy to let you guys go. However, hang with us for a little bit. We'll stick around for another 10 minutes if anyone has any other questions. But really appreciate everyone being here. Thank you for your time. We're excited about this grant opportunity, and we're hoping this is something we can build off of for our future. So thanks again, everyone. Take care. Have a great evening. And like I said, we'll stick around for anyone else that has any questions. And then also any questions that you might have, feel free to email us as well. We'd be happy to talk that way. And we can also set up an actual phone call for any detailed questions. So happy to do that as well. But without further ado, thank you, everyone. Really appreciate everyone's time today. Yeah, Amy.
I just had one quick question. We're right under the bubble between the small and the medium size agencies right now. We do have plans to open more facilities. So is there like a point, like what would be the date depending on the number of staff? It's the end of the day and I'm not saying this really well. But like if we were to go up into the medium-sized group, even though right now we're small, would that be something that could be considered?
Yeah, I think so. As long as it's not like egregious, like, you think that you'll get to that size or whatever, but we believe you, Amy, in whatever you attest to your organizational size. So if you get to that point within the next month or two or whatever, I think that's totally fine.
Okay, perfect. Thank you.
Absolutely. Okay. I think we still have some providers on. Um, any other questions from the remaining folks on the call? Okay. Not hearing any. I think, team, we're probably good to close out the session. However, anyone on the call that has questions that weren't